So when you come to lab weekend, we learn like 130 different NFT tests. So if you went through with every patient and checked every single test, you'd be there forever and you'd get lost trying to remember what you did, and then the screen really wouldn't play any role in what you're doing. So the reason why we do the screen is, there's a lot of reasons, but one of the reasons why we do the screen is so we can see where they fail. So Josh had talked about how if they fail controlling pronation in the single leg stance squat, then that tells us that we need to check the muscles that should be eccentrically controlling pronation. So that takes out the posterior head of glute med and the posterior head of glute min, because those are tested in external rotation. We need to test things that are positioned into internal rotation. So anterior head. So that's why there's a systematic thought process. So on one of the videos that I posted here last week, somebody asked, what would you call this a difficult patient? So I don't really have difficult patients anymore, because once I understood how to trust the process and the system, it gives you a check and balance situation where you can prove your work and it keeps you moving down the line. Whereas if I didn't correlate, like now that Josh is correlating positions on the screen to positions that you put them in the test, now I saw the light bulb go off and he's like, oh, well, that makes it a lot easier. So these are the things that streamline the evaluation to treatment process and the treatment to exercise process and the patient education process the whole way through. So once you get a hold of, and this is Josh's last week, so 6 weeks. So now the light bulb just went off because I gave him one more piece of information, and now everything makes more sense than it did before.
Yeah, I would say, like, as far as like difficult patients, the only thing that would make it difficult is if, like, say a patient was failing everything, then you just have to remember each part that they were failing. There's not really a difficult part of like your evaluation in the sense of like trying to understand like why are they doing that, why are they doing this, because you're going to find that in your tests as long as you can remember what they did in their screen, and then as you're going through your test, what's failing and what's passing.
Yep. And so the way I developed that is just noticing patterns that I kept on seeing. And then going back and saying, wait a second, the reason why I'm seeing that is because this is going on. So once you start thinking through your process, which you learned in module number 1, critical thinking of the shift, once you use those critical thinking components, then you're always checking your thinking and it makes sense. So you're not falling back on some nocebo thought process that you learned in PT school or some gimmick that you saw on social media. You're falling back on anatomy, biomechanics, physiology, physics, like all this stuff starts to make sense. And now that Josh got that last little piece of info, the rest of this week, his last week, my bet is he'll be thinking, oh, this is what I saw on the screen and that makes sense with what I just saw here, so I don't need to test these muscles over there because that's got nothing to do with what I saw and doesn't correlate with what I just saw the patient do on the table. Okay, so once you have that understanding, difficult patients disappear because you can always think through the process. Now, Josh did bring up a curveball patient. So we talked about this on our Zoom call today with people that are in the shift, is what happens when you have a patient come in and you're testing and treating and nothing is coming back as facilitated. So they're inhibited, you treat it, you're pretty sure you did the treatment right, but it doesn't come back as inhibited. And it happens on this muscle, on the next muscle, on the next muscle, like nothing is coming back on. So there's a reason why that's happening. And then once you learn that reason, then you know, okay, so this is falling right in step with the thought process. Now I need to talk about this situation that could be going on with the patient that's causing them not to be able to reverse the inhibition. And once again, it comes back to science. It doesn't go into, well, let's just give them some garbage explanation just so I can get out of here and get to the next patient. Okay, so Josh's last week, I'm gonna try to get as many videos shot with him this week so he can give you more student perspective of what we're doing.